In 2025, the health system expanded universal health coverage, improved health facilities, managed many health programs, health conditions ranging from infectious diseases, chronic non-communicable diseases, international, regional, and local collaborations and medical missions. The health data analyzed provides a summary of the health status in country. In St. Lucia, the life expectancy for men as of 2025 is 70.2 and for women 77.8. We continue to note reductions in the birth rate. A total of 1,326 live births were recorded for 2025, representing a crude birth rate of 7.7 per 1,000 women of childbearing age. This is a 6.1 decrease from the previous year, 2024. The total fertility rate per woman of childbearing age is 1.06 compared to 1.54 in 2016. The total fertility rate for population replacement is 2.1. Respiratory viruses continue to circulate, especially in the last quarter of the year. We note a continued reduction in COVID-19 cases from 3.4 per 10,000 in 2024 to 2.0 per 10,000 in 2025. However, we continue to see new variants of COVID-19, influenza A, influenza B, and respiratory syncytial virus. Alongside, we noted 3 new cases of tuberculosis being reported in 2025 in comparison to 1 new case in 2024. A total of 276 cases of gastroenteritis were registered by the Sentinel surveillance system. This represents an 85% decrease in cases from the previous year, 2024. 12% of those cases were children less than 5 years of age. The normal trend of elevated numbers of cases in the first month of the year was not observed. We, however, had 2 periods of outbreaks during March and June of 2025. 24% of the cases were from Soufrière, 21% from Castries, and 14% from the Vieux Fort region. In 2025, 26 new cases of HIV were diagnosed. This represents a 2.6% decrease from 2024. 62% of the cases were male. There are currently 1,003 persons living with HIV in St. Lucia, of which 58% are male. The Ministry of Health noted a significant, that is a 91% decrease in dengue fever in 2025 as compared to 2024. 432 cases were recorded. 73% of the cases occurred in the southern districts of Vieux Fort, Mico, and Dennery. 60% of the cases were female and 43% were within the 15 to 49 age group. 1 dengue fever-related death was recorded in 2025. A total of 6 cases of leptospirosis were reported in 2025, of which 83% were male. This represents a 63% decrease over last year. No cases of malaria were recorded. St. Lucia recorded 16 new cases of leprosy, which was 8 times as many cases seen in the previous year, 2024. The observed increase in cases was as a result of targeted active case finding carried out during skin camps aimed at detecting previously unidentified leprosy cases, and this was part of a national action plan towards the elimination of leprosy, which was implemented during 2024. The increasing impact of violence and injuries due to crime and motor vehicular accidents on the hospital system and the blood bank resources remains of serious concern to the health sector. Chronic non-communicable diseases continue to be a significant source of mortality in St. Lucia, accounting for over 80% of all deaths, with cancers, cerebrovascular diseases or stroke, heart disease, and diabetes dominating as the top 4 causes of death, respectively, for the last 10 years. Despite this, males are continuing to lose more of their potential benefit to society due to assault, land transport accidents, and chronic lower respiratory diseases, that is COPD, due to smoking. On the other hand, females are losing more of their potential to society due to breast and cervical cancer in particular and perinatal conditions specific to newborns. Guided by the trends noted over the last 5 years and the data from the Behavior Risk Factors Survey carried out in 2019, primary care preventative health strengthening remains a major focus for the Ministry of Health. We continue to note low levels of health screening, increases in obesity, low fruit and vegetable intake, and limited physical activity among our population. These factors will be addressed with targeted programs and interventions in 2026 with special focus on the nutrition mandate of the Ministry of Health. In 2025, health facility closures and diversions for care due to environmental air quality issues were reduced. Significant maintenance issues were required at the Viewfort Wellness Center. Mold infestation was a major issue in several facilities, requiring significant resources for remediation at 14 wellness centers, including the Grosole Polyclinic, the Betty Wells Urban Polyclinic, and the Soufriere Hospital. The smarting rehabilitation works for Delse Wellness Center began in 2024 and was completed in 2025. The Lafag and Babonneau Wellness Centers were also completed in 2025. Construction work has commenced on the Vanna and Canaries Wellness Centers as well. By addressing both the infrastructural and the maintenance issues, the ministry aims to enhance service delivery, improve the working environment for staff, and ensure improved access to healthcare for the population. In 2025, the universal health coverage continued with the provision of antenatal care, cervical cancer screening, and prostate cancer screening in primary health care at no cost to the patient. Snakebite management and breast cancer screening were also included in the strengthening of the primary care services. In 2024, one of the major milestones for the Ministry of Health was the opening of the first phase of the Dr. Betty Wells Urban Polyclinic, located at the Dr. Winston Paris Medical Complex, which is a former Victoria Hospital. Both medical, clinical, and urgent care services are provided in a newly renovated facility, offering extended opening hours up to midnight, including weekends and holidays. This serves to provide access to healthcare to the Castries region, reducing the burden on the Owen King EU Hospital and enhancing overall healthcare responsiveness. Another important milestone in the first phase of the Dr. Betty Wells Urban Polyclinic was the successful completion and opening of the National Eye Clinic. This facilitates the provision of high-quality ophthalmic services and diabetic retinopathy to the population. The Ministry of Health recommends surgical eye procedures at the National Eye Clinic on October 8, 2025. To date, 96 surgical cases have been performed from October 8, 2025 to January 15, 2026. The expansion of the Dr. Martin Didier Polyclinic continues. We anticipate completion and 24-hour operation in 2026. The Quality Initiative and the development of the National Blood Bank, the development of the National Mental Health Framework were some of the priorities for the Ministry of Health for 2025. In 2025, for the first time, St. Lucia has instituted the Director of Mental Health Services. With the support of the Pan American Health Organization and the French authorities, this has led to an extensive consultation on mental health services, the draft mental health policy, and the review of the existing mental health legislation, which will be completed in 2026. Mental health protocols at all institutions are also under review, as well as health practitioner training at all levels of care. In December of 2025, the Quality Manager was appointed under the Health Planning Unit to coordinate and implement the quality mandate. It is anticipated the general quality of care and service utilization will improve moving forward. The St. Jude Hospital site was handed over to the Ministry of Health in November of 2025. To date, the physiotherapy and the administration building has been commissioned. The Ministry of Health is working with all stakeholders and a broad technical team to commission the dialysis unit and the other clinical units to the St. Jude Hospital site. In 2025, the Board of the Millennium Heights Medical Complex commenced the planning phase of the 5th wing of the Owen King AU Hospital to increase bed capacity for inpatient care. As per government policy, the priorities for 2026 include the strengthening of primary care, that is, non-communicable disease program to reduce the NCD burden with a focus on nutrition and the promotion of wellness, and the expansion of the universal health coverage to ensure quality healthcare for all. The Ministry of Health, Wellness and Nutrition will continue to provide the public with progress updates on the various programs and interventions during 2026.